Rachel, when we're talking about advocating for ourselves and our loved ones, what expectations are fair to set? What boundaries can we set? What should we expect from our medical providers? And when can we and shouldn't we say no?
Mm-hmm. So I think that first and foremost, you mentioned that the primary care doctor was your quarterback, right?
Yes.
So you got to remember you're like the owner of the team. This is your body.
Oh, I like that.
Yes.
Nice
and
analogy.
so yes, you are top tier in this team. So you have the ability to say no whenever you want to, but that could be also dangerous. You like, again, going back to checking yourself, you want to make sure that you're educated and why are you saying no? But if you have a good reason, don't ever be afraid to. And that's where the second opinion, I feel like, comes into place, because if you have two people telling you the same answer, it might be time to reevaluate, why are you saying no?
Mm-hmm.
But the second opinion might also give you some more education. I think something that we can expect from providers is to listen to you. If they don't, they could have every knowledge memorized from a book, and had the highest titles and prestige from their schools, but if they can't apply it, it's going to be worthless. It's like going to someone with no experience because they can't apply that to you. So I think that they should have to be a good listener. I think that you also need to make sure they're experienced, and that's something I don't think a lot of people realize.
You can ask that.
You can ask
how many
that.
of these surgeries have you done?
Correct.
Yeah.
How many do you do a year?
Mm-hmm.
How often do you see this patient? What's your specialty? In medicine, we see a big trend of subspecialty. Before, you would have a primary care doctor and you'd have maybe like a cardiologist or a thoracic surgeon. Now we have some people that are subspecializing just in the little veins in the heart, or in the arteries in the heart. We have people that see lungs, but then we have general pulmonology, we call it, and they used to see every lung disease under the sun. Now we have pulmonologists that just see lung cancer, just do emphysema, and COPD. Some just do asthma. It's so subspecialty, and I would recommend trying to find the doctor, the specialist that sees your subspecialty. And with surgeons, this is more important than anything, in my opinion. Surgeons aren't always known for the bedside manner.
Yes, that's true.
But you don't need them to. You don't need them to give you
Yeah.
a hug after surgery. I always tell my patients this. I said some patients would have mixed reviews on a surgeon I really like. I'm like, listen, you can see a nurse practitioner for this, or you can see your primary care for this. You need them to do the surgery really well, and so you want to know how many, and is this their specialty?
And it's okay to ask.
Absolutely.
Yeah.
You can ask anything, and that could also help gauge. You know how we talked about how do we know when we feel like, how do we know when to say no, or what gives us that strength? Asking questions, and you can see are they clicking with not just your personality, but what is your goal in your medical care,
Yeah.
And another expectation, follow through, someone that's not going to just dump you once you're done until you're ready, I want to say, there is a little bit of a recovery time, even with a surgery. Again, my son had brain surgery. His neurosurgeon followed him to make sure everything was good with his brain surgery for 2 years. This was our intense follow-up, where we were going regularly for MRIs. It wasn't my expectation that he would see my son through his therapies, because that's nothing to do with the surgery.
Right.
Although there might have been a complication from the surgery, or a side effect, unfortunately, of brain surgery, to lose some physical or mental capabilities. That's not his job to recover it. That's the therapist. So maybe throwing something on us as the patient is knowing who does what on your team.
Yeah.
That could be something, but asking is how you're going to find that out.
Yeah. I would say the other thing in my experience is when you are given, and it sounds to me like you were kind of in the same situation, when you're given a really serious diagnosis and action has to be made, it's like for a minute time stops and everything slows down, and then it speeds up really fast. And they're like, you got to sign this document, and we got to get your surgery scheduled. And it's a little crazy and overwhelming.
Yes.
And I feel like sometimes people get rushed into things, and it's okay to say, I'm not ready to schedule this right now. Like I remember them getting phone calls saying, we got to schedule this thing. And I'm like, wait.
Yeah.
Like, can I take a breath for a minute? Can I, and I think it's okay to, like, if you need things re-explained to you, if you need to slow down, if you're not ready to schedule something and you need to put it out another week.
Yeah.
Another appointment to clarify.
Yeah.
It's okay to not ride the wave that they throw at you.
Yeah.
That's a hard no.